So good day everyone, I am Nikki Angel May T. Sagan together with Kristen Carolyn Sanchez, and today we're going to discuss about those common medications that are used in Pedia. Okay, so in here we're going to discuss 5 medications. Dito ay di-discuss pa namin yung name, mechanism of action, indication ng drug na iyon, contraindication, adverse effects, nursing responsibilities, drug interactions, and of course the pharmacodynamics and pharmacokinetics. Okay, so first one is the amoxicillin. Okay, so the brand name of amoxicillin is that it can be amoxil and laretide. Okay, so the therapeutic class of amoxicillin is antibiotics, and the pharmacological class of it is aminopenicillin. So, ano nga ba yung mechanism of action ng amoxicillin, kung paano ba ito nag-work para maging effective. Okay, so amoxicillin inhibits cell wall synthesis during bacterial multiplication. So, yung route niya is through the mouth. The onset is unknown. Peak is 1 to 2 hours. The duration is 6 to 8 hours. And the half-life of amoxicillin is 1 to 1.5 hours. Okay, so ano nga ba yung gamit ng amoxicillin? Ano pa yung ginagamot niya sa mga especially sa mga bata. Okay, so the indication of amoxicillin is that it uses to treat certain infections caused by bacteria. Kung yung bata merong pneumonia, bronchitis, or infections of the ears, nose, throat, urinary tract, and skin, amoxicillin yung binibigay nila. Okay, however, it is contraindicated in patients hypersensitive to drug or other penicillin. So, hindi po pwede yung amoxicillin sa mga hypersensitive na patients sa mga drugs or other penicillin. Okay, so ano nga ba yung mga adverse effects ng amoxicillins? This includes seizures, anxiety, confusion, agitation, dizziness, reversible hyperactivity, anxiety, vomiting, diarrhea, and of course, nausea. Okay, so as a nurse, ano nga ba yung mga responsibilities when giving these medications? So number 1 is that obtain specimen for culture and sensitivity test before giving first dose. Begin therapy while awaiting results. So it is important na mag-obtain ng specimen. So next one is to give a drug with or without food and place drops directly on child's tongue for swallowing, or add to formula, milk, ginger, or other cold drink for immediate and complete consumption. Okay, so yung amoxicillin, pwede siyang mag-interact sa mga medications like warfarin, allopurinol, probenecid. It may also interact with alcohol and some live vaccines. So in warfarin, when interact with amoxicillin, it may enhance anticoagulant effect. Next is probenecid. Kung nag-interact siya sa amoxicillin, it may increase levels of the amoxicillin and other penicillins. So next is the live virus vaccines. When interact to amoxicillin, it may decrease effectiveness of live virus vaccines. Concurrent use isn't recommended. The pharmacokinetics and pharmacodynamics of amoxicillin. So, amoxicillin competitively inhibit penicillin binding proteins, leading to upregulation of autolytic enzymes and inhibition of cell wall synthesis. Amoxicillin has a long duration of action, as it is usually given twice daily. So that's all about the amoxicillin. Moving on to the next medication, which is the azithromycin. Okay, so the brand name of azithromycin is Zithromax, and the therapeutic class of it is antibiotics, and the pharmacological class of it is macrolides. Okay, so what is the mechanism of action of azithromycin? So it binds to the 50S subunit of bacterial ribosomes, blocking protein synthesis, bacteriostatic or bactericidal, depending on concentration. So the route is in the mouth. The onset is unknown. Peak is 2 to 5 hours, and the duration is unknown. Okay, so the half-life of the azithromycin is about 3 days. Okay, so ano nga ba yung gamit ng azithromycin? So it used to treat certain bacterial infections such as pneumonia, bronchitis, sexually transmitted diseases or STD, and infections of the ears, lungs, sinuses, skin, throat, and reproductive organs. So it is contraindicated in patients hypersensitive to azithromycin, erythromycin, or other macrolide or catalyte antibiotics, and in those with history of the cholestatic jaundice, or hepatic dysfunction from prior use of azithromycin. Okay, so the adverse effects of this drug are fatigue, headache, somnolence, dizziness, chest pain, palpitation, eye irritation, abdominal pain, anorexia, and rash. Okay, so the nursing responsibility in giving this drug is that number 1, to monitor patient for superinfection. Drug may cause overgrowth of non-susceptible bacteria or fungi. Number 2 is to monitor patient for CDAD, which may range in severity from mild diarrhea to fatal colitis. So the third one is to monitor patient for allergic and skin reactions. And fourth one is to monitor patient for jaundice and hepatitis. Okay, so azithromycin can interact with medications like the vigoxin, carbamazepine, phenytoin, and ergotamine. Okay, so in the goxin, if the interacts with azithromycin, it may increase the goxin level, and it is important to monitor the goxin level. So next one is carbamazepine, phenytoin. It may increase level of these drugs. So also monitor drug levels. So next one is the ergotamine, may cause acute ergotamine toxicity, and it is important to monitor patient closely. So moving on to the pharmacokinetics and pharmacodynamics of azithromycin. So it follows oral administration. Azithromycin is rapidly absorbed and widely distributed throughout the body. Rapid distribution of azithromycin into tissues in high concentration within cells result in significantly higher azithromycin concentrations in tissues than in plasma or serum. Okay, so the other 3 medications will be discussed by Casey Sanchez.
So mag-proceed naman tayo sa cephalexin. Ang brand name niya ay Keyflex. Ang therapeutic class niya is antibiotics. Ang pharmacological class niya is first generation cephalosporins. Cephalexin mechanism of action inhibits cell wall synthesis, promoting osmotic stability, usually bactericidal. And ang route niya is PO, onset is unknown, and then ang peak niya is 1 hour. Ang duration niya is also unknown. And then half-life, children ages to 3 to 12 years old months is 2 to 1.5 hours. And then for neonates is 5 hours. And cephalexin indication used to treat certain infection caused by susceptible bacteria such as respiratory tract infection, otitis media, bone infections, skin structure infections, genitourinary tract infections. And then, ang gamot na ito ay contraindication sa mga tao na hypertensive to cephalosporins. And ang adverse effects nitong drugs na to ay dizziness, headache, fatigue, agitation, confusion, anorexia, diarrhea, abdominal pain, vaginitis, and anemia. And ang nursing responsibility naman is, bago magbigay ng gamot is ensure that the patient isn't allergic to penicillins or cephalosporins. And then, pwede din siyang ibigay without regard to meals, but magbigay ng drugs with food or milk to lessen the GI discomfort. If large doses are given or if therapy is prolonged, monitor patient for superinfection and diarrhea, especially if patient is high risk. And then for drug interactions, cephalexin can interact with medications like aminoglycosides, and metformin and warfarin. And then for aminoglycosides, may increase risk of nephrotoxicity, avoid using together. And then for metformin, may increase metformin level. And then, namomonitor niya din yung blood glucose level closely. And then for warfarin, may enhance anticoagulant effects. And then monitor therapy. And then for pharmacokinetics and pharmacodynamics, cephalexin is rapidly and almost completely absorbed from the gastrointestinal tract with oral administration. Absorption is slightly reduced when it is taken without regards for meals. So, ang next drug naman natin ay ibuprofen. Ang brand name naman ay Advil and Motrin. And ang therapeutic class niya ay NSAIDs. And then, ganun din ang pharmacological class niya. And then, for mechanism of action, this drug may inhibit prostaglandin synthesis to produce anti-inflammatory, analgesic, and antipyretic effects. And then, ang route niya is PO. Onset is variable. Ang peak is 1 to 2 hours. And then, duration is 4 to 6 hours. And then, for indication, this drug used to treat mild to moderate pain. And then, nahihat niya din na ma-relieve ang symptoms ng arthritis, such as inflammation, swelling, stiffness, and joint pain. And then for contraindications, this drug is contraindicated with the patients which is hypertensive to drugs with angioedema, syndrome of nasal polyps, or bronchospastic reaction to aspirin of other NSAIDs. And then, ang adverse effect nito ay, of course, dizziness, headache, nervousness, edema, fluid retention, bloating, constipation, heartburn, nausea, vomiting, and rash. And then, for nursing responsibilities, make sure to check renal and hepatic function periodically in patients in long-term therapy. Stop drug if abnormalities occur and notify prescriber. And then make sure na, and nursing responsibility din is i-monitor ang BP ng pasyente because yung drug ay pwede mag-lead to new onset HTN or mapapawers niya yung pre-existing HTN which may contribute to the increased incidence of CV events. And then for drug interaction, and ang drug na ito ay pwedeng mag-interact with medications like cyclosporine, aspirin, and methotrexate. And then for cyclosporine, pwede niya itong i-increase yung nephrotoxicity of both drugs, i-avoid natin using together. And then for aspirin, may negate the antiplatelet effect of low-dose aspirin therapy, and then advise natin yung patient on the appropriate spacing of the doses. And then for methotrexate, pwede niyang i-decrease yung methotrexate clearance and increase toxicity. And then use together cautiously. And then for pharmacokinetics and pharmacodynamics, meron itong multiple actions in different inflammatory pathways involved in acute and chronic inflammation. And then, rapidly din siya and completely na-absorb following oral administration, and unbound concentration shows linear pharmacokinetics at yung commonly na-use na mga dose. And then, ang next drug naman natin is cefuroxime acetyl, and ang brand name naman is Ceftin. And then, therapeutic class is antibiotics also. And then, pharmacological class naman ay second generation cephalosporins. And then, next, para naman sa mechanism of action, this drug inhibits cell wall synthesis, promoting osmotic instability, usually bactericidal. And then, ang route niya din is PO. Ang onset naman is unknown. And then, peak is 2 to 4 hours. And then, duration is unknown also. And then, for route naman is IV. Ang onset niya is immediate. And then, peak is 2 to 3 minutes. And then, duration is unknown also. Next naman is IM din. Ang onset niya is unknown. Ang peak niya is 15 to 60 minutes. Ang duration is unknown. And then for indication, ginagamit siya para mag-treat ng certain infection caused by bacteria such as mga bronchitis, gonorrhea, Lyme disease, infections of the skin, ears, sinuses, and throats. And then contraindicated din siya sa mga pasyente na hypertensive to drugs, and sa mga pasyente din na may angioedema syndrome of nasal polyps or bronchospastic reaction to aspirin of other NSAIDs. For contraindications, and then contraindicated din siya sa mga patient na hypertensive to drugs or other cephalosporins. And then ang adverse effects na naman is diarrhea, nausea, anorexia, vomiting, hemolytic anemia, serum sickness. And then for nursing responsibilities, make sure na monitor yung patient for signs and symptoms of superinfections and diarrhea, and make sure na iterate natin siya ng maayos or properly. And then, this drug may also increase INR and risk of bleeding. Make sure to monitor the patient. For drug interactions, cefuroxime acetyl can interact with medication like warfarin, live virus vaccines, and low diuretics. Yung warfarin drugs is, pwede niya i-increase yung anticoagulation effects, monitor PT and INR closely. And then for live viruses vaccines, meron siya, pwede niya i-decrease yung effectiveness of live virus vaccines. Concurrent use is not recommended. And then for loop diuretics, may increased risk of adverse renal reactions. And then for pharmacokinetics and pharmacodynamics, nag-work siya the same way as penicillins. They interfere with the peptidoglycan interfere siya with peptidoglycan synthesis of the bacterial wall by inhibiting the final transeptidation needed for the crosslinks. That's all. Thank you.